Good evening and welcome to the show. I'm glad you could join us. This evening our speaker is Ivan Barry, and he's going to be speaking about visions, voices, mystics, and muses. So I'm glad you could join us from wherever you are. So this evening we have Ivan Barry. So let's just check in with Ivan and make sure that we can hear him. Hello, Ivan.
Hello there. Hello, Leslie. Welcome to Edinburgh. I'm fine,
yes.
Thank you.
Ivan's joining us from Edinburgh, and I'm joining you from Cairo. That's quite a distance, but somehow the internet makes it all possible.
Yes,
so just to tell you a little bit about Ivan. Ivan is a consultant, trainer, workshop facilitator, and presenter in the field of hearing voices. He's a practitioner with 17 years' experience in mental health recovery roles and patient advocacy in psychiatric settings and community landscapes. He's worked alongside health professionals and healers, as well as clients in the UK, Egypt, and the USA, in helping to plant the seeds of recovery and promote positive mental health. He's presented and lectured in Cairo, Alexandria, Egypt in 2010, and Madison, Wisconsin in the USA in 2011. Ivan has helped set up and run Hearing Voices support groups in hospitals and community settings in Coventry, England, Edinburgh, Scotland, and Madison, Wisconsin. Ivan has also lectured and presented on the spiritual and metaphysical aspects of hearing voices and seeing visions at Mind, Body, Spirit events in the UK, Egypt, and the USA. He has 6 years of providing patient representation and advocacy in various hospital settings throughout Scotland, and he has presented and spoken at conferences and seminars on recovery and policy planning. Ivan is an accredited and trained in independent advocacy and in person-centered planning tools. He's worked with individuals and groups as diverse as young people in psychiatric settings, adult acute admissions into psychiatric hospitals, and forensic psychiatric hospital clients. He has also run recovery and futures planning sessions with young offenders and challenged and hard-to-reach young people in Scotland, UK. I met Ivan back in 2010, I believe, the first time he came to Egypt, and a mutual friend introduced us, and then he did some workshops and some talks at the center. So I've heard a lot of his work, what he's done, and it's quite interesting, as I think you're all probably very interested in what he's doing, because this is a subject that has a lot of mystique around it and also is probably somewhat misunderstood. Ivan is very knowledgeable and passionate about the work that he's doing, so I'm happy that he's here to share it with us and to enlighten you about what's going on in the field of hearing voices. So let's get to some questions, and maybe you can just start, Ivan, with telling us about how you came to work in the mental health field.
Absolutely, yes. It was probably in the early 1990s. I worked briefly in a drop-in centre in England, which was designed to offer support to people with enduring mental health challenges. And after a little while in that role, I was invited to train as a community support worker in mental health. It was for a charity called Mind, which is quite well known in the United Kingdom. And I spent 4 or 5 years working as a support worker, visiting folk in their own homes in the community. I then, obviously, I came across clients who sometimes did have challenging voices to deal with. And that was probably my first exposure, in as much as I remember not knowing what I should say or do in response at the time when people were having their difficulties. So that sort of began an inquisitive journey for me into this amazing landscape. From that point, I met a lady who told me about a gentleman from Scotland called Ron Coleman, who was who'd been in the psychiatric system himself, I think, for a decade, diagnosed with schizophrenia, and he was giving a speech in a nearby English Midlands town called Wolverhampton, and I was so excited by his story of taking ownership of his own experience and reclaiming his voices, as he saw it, back from the mental health professionals, that that inspired me to start my own journey of looking into, what are the definitions around conditions or so-called disorders like schizophrenia, and also to explore a little bit about different cultural responses and understandings about what it means to hear voices that nobody else can hear, or see things sometimes, of course, in slightly rarer experiences that nobody else can attest to, and also to learn a little about what it's like to get a diagnosis of schizophrenia, how that might be perceived to be helpful, but also has its own built-in legacy, which can follow people around for a lot, and can be seen sometimes as not a very useful diagnosis when it comes to issues like empowerment of self and recovery. So I started a Hearing Voices group. I just rented a church hall in the city centre of Coventry for 6 weeks, and put up a picture of Joan of Arc. I think she was the first person that I explored a little about, a famous historical figure who had voices and visions, and had made a big, a significant impact, obviously in our own life, but also in the life of a whole nation. And so I printed out a picture, and I waited for several weeks on a Wednesday evening in the rain, sitting outside drinking coffee, and on the third week a gentleman with a big black eye turned up and asked me what I was doing there, and I explained that I didn't really know. I was trying to offer a little bit of a space for people who have voices where they might feel more comfortable to come and explore, share, discuss, or just meet other voice hearers in a setting that wasn't necessarily a part of the medical landscape. And then I asked him how he got his black eyes. I rolled him a cigarette at his request, and he told me that he was actually shouting at his voices the week before he met me, and some men in a bar had attacked him outside the bar. So the next day I was in a cell phone shop, and I asked what they did with broken cell phones, and I asked for a few, and they gave me some, and then the following week he turned up from the homeless hostel with 2 more gentlemen and a lady. They all had voices. Some had a diagnosis, some had not revealed their experiences to health professionals or asked for any help with it. And I gave him the cell phone that looked like it was working, and I simply said, if you want to shout at your voices in public, you can just use this phone and normalise your behaviour. And he was really pleased. He said, "Does the phone work?" And I was like, "I'm not that wealthy that I can buy you a functioning cell phone, but you're very welcome to use this as a prop." And that was my first real sort of cognitive, tiny awareness around cognitive responses that can make a little bit of a difference. And through meeting Ron Coleman, I got introduced to an alliance of recovery-focused, excitable people, both who maybe heard voices but also worked in different health roles, who were determined to try to make a little bit of a difference in changing or helping change the way we might think about hearing voices. So that was early days, and there were quite exciting conferences. There was quite an excitable and still extant sort of psychiatric survivor movement, which was operating still in the UK, particularly in the sort of 70s and 80s, with people calling for change in psychiatric services and different ways of doing things that didn't limit recovery, but offered up other alternatives. So I started attending quite a lot of these conferences, and then I followed Ron around for quite a while, listened to a lot of his speeches and lectures, and he's a very inspiring gentleman who still hears voices, but now he travels the world giving fantastic sharing opportunities and workshops to both to people who hear voices and family members and supporters of those folk who want to be able to access better tools for managing their own experiences, as well as providing training direct to health professionals who slowly the message seems to be getting through that there's always more we can do to be of assistance to people, to help folk make a difference in their own lived experiences. So that was my early introduction to the world of hearing voices. The first gentleman I met who was having a difficult time, I really was at a loss as to know how to respond to his distress, because he was shouting at his voices and was very distressed by them. And when I asked for advice from senior workers back at the service that I was working at, I was simply told to play Scrabble or see if the soccer ball was still under the staircase. And I realise now they were basic sort of distraction techniques to try to get somebody to do something just to take their mind off what's going on in their mind briefly. And he got really upset when I suggested that, because every support worker apparently he's ever met has simply said to him, "Do you want to play Scrabble?" or "Would you care to kick a football?" And he threw a tin of baked beans across the kitchen, got upset, burst into tears, and he said, "I just need somebody to talk to me about my voices." And I said, "I'm not allowed to." And he said a few more things, and I said, "You know what? Maybe I can't talk to you about them, but I wonder if I can listen. What do you want to say?" And it was very energizing experience and a liberating experience, because he was able to make a cup of tea, come and sit down, and he spoke for 3 hours about the tortuous nature of his lived experience as a person who who's on the receiving end of abusive and critical voices for many, many years. So it was interesting, and I wanted to know what psychiatry thought about schizophrenia and so-called auditory hallucinations. So I did, through my support work, I built up some quite good relationships with health professionals. I tried to be a polite and professional mental health worker and always encourage folks to ask the best kinds of questions that they wanted to around their own care and treatment and their own experiences. And I went to see a psychiatrist in Coventry on a one-to-one basis, and I just said, "Can you tell me a little bit about what schizophrenia is?" And, well, we had a very revealing discussion which taught me a lot about just what they don't know about what schizophrenia really is. And he was very honest to say that it's a work in progress, it's a theoretical medical framework, it's a loose cluster of disorders or behaviours that can be aggregated together and in alliance with a few of the sort of aspects of symptomology in the so-called diagnostic manual. And that includes, at that time, the prevalence of auditory hallucinations. Then a diagnosis of schizophrenia was what was given to people. But I started to look into the recovery rates, both currently using World Health Organization research, and what I learned was recovery rates, which means the full remission of symptoms and the quality of life available to a person. That means they're reasonably well. In 1939, the recovery rates for schizophrenia were 33%. In 1966, research was published, the recovery rates for schizophrenia, despite the advance in psychiatric medications that had come around, they were using a lot of new drugs in the 50s and 60s, it was still 33%. And 1985, I think, the latest research I looked at that point, you can guess what the recovery rates were. They were stuck at 33%. And that means 1/3 of people who use services, take medications, receive treatments and support are lucky enough in some ways, if the measurements are correct, to be free of the symptoms of a so-called psychiatric disorder called schizophrenia. But it means that 2/3 of the people who are interacting with those services and hoping for amelioration of their symptoms are stuck and not helped at all. And so I learned that the diagnosis of schizophrenia can mean, a lifetime as a client, a patient, a person with a label. There's a lot of misunderstanding around schizophrenia. The tabloid press are not very skillful at presenting health issues relating to experiences like this. So there's a great deal of mystery and misunderstanding when you ask people on the street what they think schizophrenia is. The first response is normally, well, it's a symptom of a really severe brain illness. And then I speak with them for a little while and sometimes talk about other people, historical figures and current ones who've had these experiences of auditory hallucinatory phenomena without the necessity in many cases for seeking medical help, and people quite quickly normally start to open up their own conceptual mind around these things, and quite often they share with me some information about either their own lived experience, family members, aunts, uncles, people that they know, and realization dawns on them that hearing voices is not necessarily a symptom of anything. It's an experience of itself, and it's how you understand and accommodate, process, and work with that experience that can determine whether a person becomes a patient of psychiatric services or an artist painting a masterpiece in a garret somewhere, guided by their voices, of which I know several.
And you were saying that unless the voices are bad or telling them something horrible, that they may not even seek out any kind of help for it.
Yeah, for sure. Why would you? If you're being told beautiful things about yourself, your world, or the voices are guiding or advising you in creative ways that are related to sort of personal self-expression and an artistic endeavour, or just telling you, making you feel nice, telling you nice things about yourself when you look in the mirror and you're brushing your teeth. If you've got a nice voice that says "Good morning, handsome," that's not going to do you any harm. You're not going to be asking for help from anybody. There are also, though, it was interesting because the early days of the Hearing Voices movement and starting to have conferences where people came together more to share their experiences, one of the great learnings, and we'll come to this in a little while, is that there are a group of people in all populations who hear voices who are not patients at all and have never had any mental health support, and they've never needed any. But there's a group also that have challenging auditory voices that would fit the profile of the Diagnostic and Statistical Manual, who have challenging and critical voices, but they've developed strategies and ways of managing and coping with those experiences that can be shared with other groups of people who have the same experience but struggle to cope. So it's around. So that's what we learned. I started exploring a little bit of cognitive behaviour therapy, and we'll touch upon this in a little. Currently, I've got a person who's, for example, time sharing with their voices so that they can get on with their university studies here in Edinburgh, because they were hearing voices every day. The voices appeared, they think, because they're stressed out a little bit with falling behind in coursework, and there's a few other things going on in their life that we identified as stress factors that increase your level of anxiety and then perhaps make voices a more likely occurrence. And this gentleman, I suggested, that he negotiate with his voices by at nothing to lose by asking them to leave him alone. And if that doesn't work, instructing them to go away, even if it's just for certain parts of each day. And if that doesn't work, ordering them to go away. And he texted me a few weeks ago to say, even just asking them politely to give him some space so he could study it at certain times of the week has worked for him. And he had 2 voice-free days. So he's really pleased. And now the trick is to try to get 3. Then we're going to ask the voices for 4. And we'll do a timeshare reduction over time. So there are things people can do. And I think it was when I worked in the community I met my first voice hearers, so to say. But in the hospital setting, of course, it's a more acute landscape, very institutional. Nurses have, and doctors have a lot of power invested in their roles, and people are often treated and detained on a compulsory basis. They may not always choose to be in a psychiatric hospital, but they're forced to attend or compelled to stay there. And in that group of folk, it was decided that having a hearing voices group in a landscape like a psychiatric hospital that was free of any single framework of reference for understanding it, but was a group where people could come and share their stories, explore their experiences in a safe setting, and if they wanted to say that they had that they were schizophrenic, that was permissible, because some people would accept the medical model, and that's how they described their experience. But there were lots of people in those groups who said that the doctors were mistaken to identify their experiences as being part of a psychiatric or neurological disorder, and they had either their own explanation for what was going on, or they needed or they wanted to explore one, and that could often be spiritual explanation or a spiritual framework of reference. And sometimes people had no framework of reference and were just confounded by their experiences. So it's interesting when you get people who have a tough time with voices, who struggle to cope, and they can meet folk who are doing quite well. That's quite inspiring to see people take inspiration, from each other. And I learned a lot just by listening. My job was to facilitate those early voices groups, and a lot of them is finding out as you go what people want from the group. So it was directed by people who attended it with my sort of gentle orientation. And we would continue every week. It seemed like a good idea to bring a historical figure in to talk about how some folk have actually changed their lives and the lives of many by listening and paying attention to the kind of voices that they had, and in some cases, of course, taking action, which has led to whole things like it's triggered cultural shifts in thinking, instigated whole new philosophies of spiritual belief, which many millions or billions of people subscribe to as we speak, and I was constantly amazed by delving into the world of voices and visions, finding out, of course, that there are many mystics, and finding out also that many people meet their muses who inspire them to great things, and we can talk a little bit more about that in a little while. So yes, and I've worked in a variety of different psychiatric settings, both as an advocacy worker, which is basically representing the interests of patients in their dealings with the system. So you would meet folk, introduce yourself, find out what they'd like to say, what information they'd care to know, and then go to the doctors with their permission and represent them and ask what is the plan for this person and what is the current thinking amongst the medical staff, and then you would go backwards and forwards a bit like a badminton shuttlecock or a tennis ball, picking up information and basically sharing it with both sides, so that patients felt they had somebody in their corner at one of the, during an experience that you might say might be one of the most disempowering individual experiences that you'll ever have, which is to be a psychiatric patient.
Well, and it sounds like listening is a big part of the problem, that if the recovery rate is not higher, it may be because the medical profession is not listening to what these people are saying, like this one man told you. No, they've tried to distract me. That's not actually working. So, I think your role as an intermediary is very significant, because somebody has to, somebody has to come up and say something's not working. And I'm sure that it is when people feel more empowered, they're probably more likely to express themselves as
Absolutely.
To how they could be helped.
Well, that was one of the most pleasing aspects of that role. By modelling advocacy, quite often people would learn to advocate for themselves, and they would basically fire me politely. So they'd say, well, I've got a big meeting.
Well, that's a good thing, yeah.
Yes, it is. I don't need you to be there, because I've made my own notes, I've got my questions ready, and I'm going to go to this meeting. And they'd gain in confidence a little.
Yeah, and they've been disempowered, and people don't know how to take their power back. So, they need an example. Yeah,
absolutely. And psychiatry is a very powerful authority. It's the only branch of medicine that is given permission by the state to, to treat its patients or its clients, even against their wishes. It's quite unique in that regard. And it's difficult for patients coming up against that, because a lot of people are a little afraid of authority, and psychiatrists, consultant psychiatrists, are a bit like pharaohs at the top of a pyramid of power, unquestioned authority, which further down the pyramid, the other ranks of psychiatric nursing staff and clinicians and pharmacists, well, they ideally don't like to argue or debate too much with decisions that consultant psychiatrists make. So that was an interesting experience too, because I realised it's not a very good discipline for self-reflection in terms of the little bits of training and workshops I've done with doctors and trainee consultant psychiatrists around voice hearing. One of the things is, of course, the origins of the word psychiatrist are soul healer. And so a good question for doctors is to ask how many souls they feel they've healed so far this year. And then, you can ask them things like, have they ever heard voices themselves, and take it from there. And they often say no. But the next question is, have you never heard your voice called? And when you turned around, there was nobody there. And normally half the hands in the room would somewhat slowly raise, and I'd joke, and this is a trick I learned all the way back from Ron Coleman's training when he was speaking himself, was to say, well, then you have heard voices, and then there'd be a little bit of laughter and a lessening of the tension in the air, and we'd get on with looking at what it means to hear voices, the consequences, and whether the experience of hearing voices really fits neatly into the medical profile as laid out in the diagnostic manual, or is it just a very challenging, sometimes human experience for people? So the voices groups were brilliant, and they, I think when they started, early days, I think there's 170-something around the world. In fact, the Hearing Voices Network have produced a map which shows the growth of peer-led, quite often, but sometimes with professional allies, support groups, either in hospital or community settings, and they are springing up like mushrooms, basically. Because it's a very liberating and emancipatory response to hearing voices, to give people some power back and ask them some good questions about their experience, which allow them for self-reflection and then encourages personal growth. And then when they learn that they can try to apply strategies that might be useful in managing their own lived experience, then that's got to be a good thing. I think the difficulty in the hospitals, the acute admission wards particularly, is that the staff are basically, quite often they're under-resourced and understaffed, and they're firefighting all the time, and it doesn't give very much time for nursing staff to spend any time really talking with people about the historical events that led, first of all, to their hospital admission, what was going on for them, and it certainly doesn't really allow very much time for longer discussions relating to all the right kinds of questions about what's going on when you're hearing voices that nobody else can hear. Like, how long have you been hearing them? What do they say? And all the rest of it. And we can come on to a little bit of that in a while, if that's okay. But there are simple strategies for externalizing an experience. I think the gentleman I met all those years ago, not the guy I gave the cell phone to, but the person I was trying to support in the community, he'd been living with this intense, tortuous internal experience for years, and nobody seemed to want to discuss it with him. I attended some outpatient appointments with him, and what I noticed was, even if he'd had a terrible few weeks with his voices, he would tell the psychiatrist that the voices weren't bothering him, and that he was okay, and could he go now, please? And then afterwards, when we would have a debrief meeting, I would say that I was surprised that he underreported his experiences, because I'd witnessed his distress at times in the weeks leading up to the appointment, and what he said was quite revealing. He said that there's no way I would tell that guy that I'm hearing voices at the level I am, because his only response will be to increase the level of my injection in terms of my
which shows that he's sane enough to know that.
Yes,
he's not.
Absolutely, yeah. Indeed.
So
but
it's not that he's crazy or something, but that that he's very much aware of what kind of response he's going to get.
More medication, basically, and of course the side effects, the adverse side effects. Well, they're not really side effects; they're just other effects of a drug. But there are quite skillful language is used to describe unwanted or undesired effects of medication as side effects, almost as if they're just like surprising anomalies that happen to pop up for that individual. But they're really just, these drugs do have a broad series of effects on a person's neurology, and consequently their functions and their cognitive abilities and their feelings. And this gentleman used to stay in bed for 3 or 4 days feeling really awful after he'd had his monthly injection. So I used to see basically how stuck people with that label seem to be, whether they're in a community setting or in a hospital setting, and that the medical model was very reductionist. And because psychiatry has become predominantly a neurobiological profession, it's almost forgotten to ask questions about the human and the soul person at the heart of that experience, because it concentrates on brain function and then ticking boxes in the criteria for trying to assess whether a person has a disorder or an illness or not, so they can effectively provide treatment. So it's a bit of a carousel that people get caught up on and go around. And I met people who've been going in and out of psychiatric hospitals for 25 years with the schizophrenia diagnosis, and some of those folk would come to the Hearing Voices groups, and they would acknowledge that they were the most benefit they seemed to have was a slight diminution in the level of the voices that they heard. But it was very rare that people would say that the medications and treatments they were given made the voices go away entirely. So they were left with a legacy of unresolved stuff. So it's been
and I
amazing.
think this is a huge problem too, just in healthcare in general, is determining which people need to be treated and which people don't, and at what end of the scale, and those that don't, there should be some other kind of
Well, it's interesting you say that, Leslie, because the psychiatrist that I went and spoke with all those now years ago when I still had hair on my head, his response was to say that they're just, he couldn't say to his clients basically that they don't really know that much about what they're actually doing, and that they're developing hyper-theoretical systems to try to understand. Because in the hospital, I remember a guy telling the doctors there's no way they're treating him as part of a research experiment, and they wrote that up in the medical notes for that gentleman as that he was paranoid and aggressive, about and making delusional claims. But in fact, the honesty of the situation is, even new medications, when they're given permission to be launched, directly into the marketplace and then into the public, the 10 or 20 years after that is followed with longitudinal studies where the measurements are actually being made as we go around the effectiveness or the efficacy of these medications. So in effect, that gentleman was making a true claim. He was, as he saw it, the subject. He called himself a guinea pig, and he said, I don't want to be a guinea pig for their psychiatric experimentation. And of course, that was perceived as, I don't know if you know, but even slaves who ran away from their slave owners in the 1920s and 30s in America, there was a disorder called, in the mind of the psychiatrists at least, drapetomania, which was the irrational desire of a slave to escape from their slave owners, because that's where you're looked after, fed, watered, and given work, and it's irrational that you would want to run away from those situations. So
it's all where you're standing.
Well, I don't want to suggest that psychiatry sets out to enslave huge proportions of its customers, patients, or clients in any way at all. Most of the psychiatrists I've actually spoken to in May turned out to be quite caring folk who came into the profession with a burning desire to ameliorate illness and help people get well. It's just, the things, and things go in and out of fashion all the time. So you get models of treatment that are popular. 90 years ago, we were measuring the bumps on people's heads to try to determine whether they might be criminal or insane. And let's go all the way back to the inquests, the Inquisitions. Psychiatry is very interesting because it has special permission to do things that no other branch of medicine can do, which it needs to tend its responsibilities carefully. And when people enter that landscape, it is a bit like David and Goliath, And the other thing the psychiatrist said was interesting. He said, if I was to reveal to my clients in discussion with them that I'd like them to try these medications for their condition that I think exists, and I'm pretty sure it does, but there still is no single pathology that proves any neurobiological or psychiatric disorders, and they haven't identified a single genetic component of schizophrenia, despite looking into that for 20 years. So that's been kind of gently abandoned. His worry was his authority would be undermined. Patients wouldn't, when they come to him, there's an expectation of getting help and that he's a repository of some expertise and knowledge. And if people were to think that if they were to see a psychiatrist and that wasn't the case, why would they engage in treatment with a person who clearly acknowledged that he wasn't an authority and didn't really understand the whole landscape around concepts like schizophrenia? So they would lose their client base basically over if they were to. Now there are one or two psychiatrists I know who are very open with their clients, and they say to them, where these are all sort of theories, but we're developing them, and they've got some grounding in research that can be shown to be accurate. And what I'd like you to know is these medications work for some people, but not for everyone. I'd like you to try them and keep in touch with me and engage with me around whether you think they're helpful or not, whether you're getting adverse side effects or not, and we'll measure it as we go. And this gentleman gets higher rates of engagement with medication than many of his peers, because his approach to that whole process is one of a shared sort of collaborative arrangement, and I'd like to see lots more of that, frankly.
Yeah, and I hope that people are taking more responsibility. I mean, that's the point. I think there are a lot of people who want to be taken care of, and they just want to go to somebody who's just going to say, this is what it is, or this is what's going to work, and then there are other people who are interacting and can do some of the work on their own and research things and feedback to the doctor, and so I'm sure that has a lot to do with the personality of the patient from where they're standing in all of that.
Yeah, interestingly, in the Hearing Voices groups, both in the community and the hospital, I found that the older generations of folk were a bit more likely to sort of buy into the concept of the authority and expertise of the doctor and not question or challenge things that the doctor said. So I quite often, in my advocacy role, met folk who were on multiple medications, and I would ask, do you know what they're called and what they do and what they're supposed to do and what side effects to look out for? Quite often, they would just describe them by colour, and they say, well, I take 2 green ones and an orange one, I have a yellow one at bedtime. And I found out that in many cases, hospital nurses just weren't handing out information to the patients in the hospital in particular about their medications. And when I used to go to clinic rooms to request information, especially for folk in the Hearing Voices group around the medications they were being either asked or compelled to take, although the nursing staff were polite to me, and quite often they would get it in response to my questions about why they weren't handing it out, their fallback response was, if we give it out, people won't take the medication because they read all the side effect warnings, and some of them, in rare cases, are quite severe, adverse, and so consequently people say, I don't want to take these, so we tend not to hand them out. Legally, they're obliged to give that information to patients. So the role
I was going to say, it's your choice whether you want to have those effects or not.
Yes.
Yeah.
So that's been my. So basically, the subsequent years, I've worked in Scottish psychiatric hospitals for around 7 years. That included forensic settings in Glasgow. So that's working with people who've been through the criminal justice system and maybe deemed to have a mental health challenge to deal with or a diagnosis following them around as well. And I do a lot of little awareness raising events. So we have an annual open day which is just called the Visions and Voices Express, and that's a little bit of some of the stuff we're going to talk about briefly this evening. It's touched upon there, and we try and then we have an annual congress. The Hearing Voices Network itself has every year a get-together with fantastic range of speakers and usually very well attended and enthusiastic audience and all the rest of it. So it is a growing phenomenon that people are wanting to get more self-control, more autonomy over their own health, and maybe a move away, who knows, from just accepting what is given to us by so-called authority figures regarding our unique individual lived experiences. And in the groups, we were happy to work with folk who said, I have schizophrenia, it's a terrible illness. Some people do describe themselves. I mean, I meet people who say, I say, my name's Ivan, and they say, my name's Jane, and I'm schizophrenic. And I say, Jane, I'm sure you're much more than a schizophrenic. Tell me a little bit about your personality, or things that you like doing, or things you've got a passion for, and we'll come to the diagnosis and the label later on over coffee. So it's been a great learning curve for me, 20 years of immersion in this amazing world, and looking at all the different ways that we can explore and understand these experiences. I didn't know that Hearing Voices had been around for thousands of years when I first worked with that gentleman in Coventry all those years ago. When I went to staff team meetings to ask about could we get some training around voice hearing, there was a complete circle drawn around that, because it was all the remit of the consultant psychiatrist, and nobody else was allowed to tiptoe across that boundary, so to speak, to gain the secret knowledge that belongs to the pharaoh. So we decided, we have to build some pyramids of our own if we want to get an Egypt metaphor in there. And that was the inspiration to get those Hearing Voices support groups up and going.
Well, why don't you talk a little bit about the Hearing Voices movement and tell us how that started and what it is? Just give us kind of an overview about what that is.
Okay. Well, why don't we start with this gentleman? I hope folk can see. This gentleman is an amazing inspiration to many people. It is Professor Marius Rom, R-O-M-M-E. He was a professor of social psychiatry at Maastricht University in Holland. I think it's in Holland. And he was looking after quite a lot of people and taking care of people's needs as a psychiatrist with a background in social medicine. And Well, I've spoken with Marius a few times at various events, but he's a very busy person and still does a lot of work now. And he was interested to know that one day a lady that he'd been treating for some time called Patsy Hager came to visit him as an outpatient, and she asked him, she'd been receiving medical treatment for quite some years, and she had, I believe, a diagnosis of schizophrenia. Every treatment that was possible had pretty much been given to her, with no remission of her symptoms at all, and she'd had quite a lot of acute admissions into hospitals in moments of crisis. And she turned up at Marius's, Professor Rom's appointment, clutching a book by a gentleman called Julian James, who's a psychologist, I think he's American. It's a book from the 1970s, and it is called The Origin of Consciousness in the Breakdown of the Bicameral Mind. And Julian James, this is the front cover of the book, so it's considered at the time to be a real breakthrough book. Julian posits that until about 2,000 years ago, all that human consciousness was at a very different stage of development to the kind of concepts we have now about what human consciousness consists of. And his theory, he draws on, for example, the Iliad and the Odyssey, the two great classic stories of Greek epics, where in many cases, many of the characters in those two fantastic epics actually have experiences where they're either instructed, warned, assisted, or obstructed by gods. His concept was that these are sort of hallucinatory experiences. So the bicameral mind is an ancient mind where the concept is that people were given divine instructions from above before we developed modern consciousness that we actually acted on. So in the very same way that we might be warned to do something, or to come back to the village to defend it, or go to the farm to work on it, Julian takes you on a journey through the development of human consciousness, and also it touches on social anthropology and history too. And this is the book that Patsy was clutching. She'd been reading this book, and she said to Professor Rom, "Can I ask you a question? This is a book that excites me enormously. I know that you think I'm ill, and that I've got an illness called schizophrenia. I think I'm just having some remarkable experiences that are difficult for me, and clearly for you as a doctor of healing to deal with, and I'd like you to read this book. And also I'd like to ask you a question. Do you have a spiritual framework of reference or a belief yourself?" And Marius agreed that he did. And Patsy said, "That's interesting because you're praying to a God that you can't see, and I'm assuming he never speaks back to you. And yet, so without evidence of his existence, you accept that he exists and you actually speak with him." So, of course, that's quite an interesting, but it's just a mirror reflection. That's precisely what people. In fact, when we pray, I walked past a church a few days ago, and I could hear a prayer being said in unison by a community of people, and it was like a voice from another time. I'm not sure if it was Latin, couldn't quite make the words out. Indistinct a little bit, but it had a beautiful lilting rhythm to it, and it reminded me of things like the echo of a sort of a voice from a bygone era, almost like a sort of an echo of times gone by, where people may have heard collectively voices. And that Patsy's theory was that some modern person diagnosed with schizophrenia, who might be having what the medical profession terms auditory hallucinatory experiences, was maybe a remnant, a sort of hangover or a left behind section of consciousness that sometimes breaks through into our modern minds and our modern consciousness, and manifests in the form of hallucinatory experiences, if that's what we wish to call them. Witnessing audible voices and seeing things that might be very clear and lucid to the person, but that nobody else, either with that person, can see or hear themselves. So that was very interesting. I think Marius read that book, and then not very long after, Marius and Patsy attended. They went on a daytime chat show on Dutch TV. So I spoke with Marius, and I think, if I remember, he said that a lot of his colleagues were really annoyed with this, because as a psychiatrist, he was going to go on to an afternoon chat show on Dutch TV. I think it was called Sonia. Patsy was going to go with him. She was going to speak about her story as a psychiatric patient and a person who had critical and abusive voices, and she was going to share some of her experiences and even a little bit of her theory. And Marius spoke, I believe, of his frustration as a healing health professional with regard to not being as effective as he would like to be, let's put it this way, when it comes to assisting folk with a diagnosis of schizophrenia or schizoaffective disorder. In effect, people who are struggling and hearing voices and stuff. So there was a discussion, and it was a very lively discussion apparently, and at the conclusion of the show, people who were watching the programme were invited to contact the show by telephone or by letter if, for example, they had voices or visions out there in the community that Marius and the show makers would be very interested to hear about their experiences. And they took 700 phone calls. So the phones were pretty lively, and they got lots and lots of letters from people. And they were from a variety of folk having different experiences, doing different things with different explanations, and sometimes with no clear explanation about their own experiences of visions and voices. And so then the question was, what is to be done to find out a little more about this group of people who've contacted the show? And a questionnaire was designed which invited folk to put a little bit of detail on their experiences. So, for example, it might ask, what kind of voices do you hear? Can you say when they started? How long have you been hearing them? Do they have a specific gender? Are they male or female? Are they positive and do they contribute to your life? Or are they neutral and they don't make any difference? Or are they negative and critical and they make life more difficult to live with? Can you cope with these experiences if they're positive? Can you cope with them if they're negative? And if you can cope with them if they're negative, how do you do that exactly? And of course, from a psychiatric perspective, Professor Rom was interested to know, was the phenomena of auditory voices. I mean, I don't know if you know this, Leslie, but currently MRI scans over the last few years have been showing that when people hear voices nobody else can hear, the same areas of the brain light up which are matched to when we hear voices that come to us in the very real sense. So the brain treats these internal experiences, it appears, to be identical as, someone standing behind you, speaking with you, or standing in front of you. So these surveys were sent out to folk, and it led to some interesting findings, as you might imagine. This was very exciting for Marius Rom, because bear in mind, most medical professionals are only going to get an opportunity to meet with people who have voices when the person has been having a difficult experience and is either asking for assistance, support and help, or has been recommended by other family members or other health professionals to contact a psychiatrist, because that's the normal route people think they should follow. It's quite straightforward. If you're hearing voices and they're not very nice, and they're making a bit of a difference to your life that isn't very helpful, perhaps you should speak with a psychiatrist. And so the medical professions, in my opinion, only for the most part experience voice hearing in its negative form, and so consequently it's no real surprise that when you speak with medical professionals, if you ask about auditory voices or hallucinatory experiences, they're quite quick to say, of course, that they're part of a process of a neurological disorder. You've got schizophrenia or a schizophrenia type problem. Now I'm just going to show, if it's okay, just bear with me for a second, I've lost my way a tiny bit. Just very briefly, by the way, here are three amazing books that Marius has authored. He works very much with a lady called Sondra Escher. Her research with children who hear voices is very wonderful as well. So Sondra's done a lot of work with younger people who, both in hospital and community settings, and she's done research also which looks at the differences between children who live in rural settings who report hearing voices and children who live in urban landscapes, and looking at the differences in the experience and the prevalence of those experiences. And only last week I was in a house in Fife talking with 3 children between the ages of 6 and 10 who were busy telling me all about their invisible friends that they play with when mum and dad have decided to say goodnight and they think their children have gone to bed. Those children are continuing to play, a bit like Cary Grant's Harvey. They've got invisible 6-foot white rabbits sitting in their room. Accepting Voices is a book co-authored by Marius and Sondra, and that's an inspiring book. It gives some historical accounts of Marius's own story and how when people are basically, there's lots of little examples. It's very readable, very accessible, and it's inspiring because it shows how if people can accept their voices rather than, because distraction only works to a degree. Ignoring them can be helpful in the short term. If they're residual voices that won't want to go away or don't seem to want to go away, basic strategies like distraction and ignoring aren't very effective, to be honest with you. You might get some short respite. Learning to listen to your voices and hear what they say and try and see if there's any meaning in the content of those voices, and that's again another area where most psychiatrists are interested in the form of the experience. You know, they're interested in the fact that you're hearing voices, but they're not that interested in what they see as the subjective aspect of your experience, which is what you think it means to you and what it might mean. so that's one of the reasons people who pass through the institutional sort of psychiatric system feel they don't get enough time from health professionals to explore those aspects.
Well, maybe you could give us some, like, what is the range? Because I'm sure that there are a lot of people that have these experiences that are not really, maybe don't understand that many people do have experience. So what kind of is the range of what people would hear? Or
yeah, absolutely. People can have, for example, a one-off experience that never repeats itself. So I'll give you a quick example, if that's okay. I was writing a presentation that had a deadline that I kept putting off for a day when I was doing a Visions and Voices speech, and the time I'd saved in the days leading up to the event got compressed and squeezed by other more urgent family matters that took my attention. And although I had a short time span, I was definitely stressed. I was staying up later than normal, not eating so well, drinking a lot more coffee, and getting a bit agitated on various subtle and subconscious levels. I worked one evening until about 3 in the morning, quietly in my room, putting what I thought was the finishing touches to this, and then I'd neglected a very important and vital component, and at 5:15 a voice spoke to me and said, "Ivan, wake up." And it was like my voice but slightly modified, and then it seemed like a dream, and then it spoke again louder, and I opened my eyes, and 60 seconds later I was sitting at my laptop typing in the missing element to my presentation without having to think about it. So they can be useful in that regard. They can be alertive. People have voices that might follow them around all day. So one of the exercises I used to do with Ron, with doctors some time ago, if they're new doctors and they're open to come on a little bit of training, was to invite them to see what it feels like to hear negative voices. So you would have a doctor sit opposite from a colleague. They would be given 2 minutes to speak to one another about any subject they wished, and behind them would be other volunteers who would speak into their ears while they were doing this, and then the facilitator or myself would ask them how that felt, and they'd say frustrating, annoying. I started to feel angry. I couldn't concentrate or focus on what my colleague was saying to me. And then you ask these folks if that was to be a more continual experience without any respite, how might that affect you? And they'd say, well, I probably would stay in a lot more, become socially isolated, become withdrawn. Perhaps self-care would suffer. I might not go to work. I probably wouldn't speak to people so much, express my feelings. I'd get caught up in my interior monologue, paying attention to that. And interestingly, we'd fill a flip chart up with all of that quite quickly, and they would see when we filled the little circular bubble with all these descriptive adjectives about the consequences of ongoing experiences if they're negative, then they'd realise, I would point out that they've got these listed in the DSM as secondary symptoms of an illness called schizophrenia, when really they're the consequences of an ongoing experience that's very difficult to be with. I met a lady a few weeks ago who was showing me around a room in Glasgow that I might hire for another day for a Voices Day. And when I told her about the nature of the day, she told me that her partner, who's been passed on, she was a lady in her late 60s, he died 5 or 6 years ago. He started appearing a year ago at her Zumba classes. He sits at the back of the Zumba class, waves to her. Yeah, and she said initially she thought, maybe I'm going crazy. There's Donald. She's a lovely Scottish lady with a little bun hair and a nice little hat. And she said, and so then she said, when I saw him, I was a little bit alarmed, and I thought, I wonder if there's something wrong, that he's started to appear in my Zumba class. But then she went to bed that night. She told me that she asked to speak to him, and she says now they start every morning with a conversation, and they finish each evening before she falls asleep with a conversation. She's met a new chap that she's been bowling with, and she asked Donald, is he okay, and does he give permission for her to hang out with this new chap? It's only purely platonic, but they get along really well, and they're both widowed, and Donald said yes. So she started bowling as well. So so the variety of experience for individual people is as broad as any human experience can be in terms of the content and the detail. Some people have voices. I worked with a lady last week who gets admitted to hospital over the last 15 years every autumn in crisis. She's had a diagnosis of schizophrenia for about 12 or 13 years, and a friend told her to speak with me. I asked her to make a voice diary for a few weeks, just to say when the voices start, when they stop, what kind of things do they say, are they positive or negative, what gender do they have, and can she locate the origin of the comments that they're making in any real lived experience in her previous life. And she went away and kept the diary for a while, and we looked over it. We spoke on the web and through Gmail, Facebook a little bit privately, and interestingly, she had two voices. One was a voice that says horrible things to her, calls her a murderer, and other more horrible words than that. And that's really so. It's had a big impact on her life because that's been ongoing, and she's had a psychiatric career as a patient, basically. I asked her about the admissions in the autumn. When we got her medical records, I noticed that each year her crisis seemed to occur at a particular point in the year. And after a little bit of thinking, it was when she had an abortion when she was a young woman that she didn't really want to have, and it happened in August when she was 16. Her family basically pressured her to not have a child because they had expectations that she would go to university and have a career like an older sister had already done. And she hung around with a sort of Jack the Lad, debonair, charming guy that her parents really didn't like at all, and she got pregnant. And so she had an abortion she didn't want, and she's been left with all these complex feelings, but she'd never joined up the dots that her admissions every autumn are related to these events that happened such a long time ago in her life. So,
but it's amazing that whoever was treating her didn't do that.
They didn't have time, she said, because she gets admitted in acute crisis, so the first week is spent on powerful medications because she feels suicidal, and she's quite often on watch, so that she has supervised nursing presence all the time. They tend to talk with each other and not with her, and so it develops a relationship with the patient or the person where it's not reciprocal. And so on the occasions when they did feel inclined to ask her about how are your voices, because she is diagnosed with schizophrenia and they know that she hears them, she would actually underreport them and say they're not so bad, because all she wanted to do was get out of the hospital again, because it wasn't a very rehabilitative environment. It was an acute admission ward, lots of shouting, people in distress, and staff themselves, are pretty neurotic with firefighting all the time. So there isn't really the sort of rehabilitative therapeutic space. I mean, the original psychiatric hospitals, the asylums that were initiated, were all about time for the person, to some degree at least. The Quakers, who opened up the first retreats here in England and the United Kingdom in particular, space and time was given. The modern psychiatric hospital, there isn't really time for staff to sit down and say, let's look at why you're hearing voices, whether those voices have any meaning with regard to your lived history. And this brings us back to the work of Professor Ron, because his Making Sense of Voices is an amazing book which tells accounts of how you might gain more information and insight into your lived experience in order to empower yourself to be able to manage your life a little more effectively. Some people do have voices that only occur at anniversaries of events. Some people only hear voices when they're particularly stressed out. Some people hear voices in response to single events. I spoke with some deep-sea divers from Cornwall in England, and one gentleman was telling me through oxygen deprivation he had hallucinatory experiences while he was actually deep-sea diving. This is one of the difficulties, of course, for a medical profession, because the variability doesn't sit neatly with wanting to have everything in a nice and tidy profile. Subjectivity and the unique experience of the individual is very difficult for doctors who are pressed for time and want to make a quick diagnosis, a nice clean diagnosis. They really don't have the luxury of saying, okay, let's spend some time getting together every week and looking at your experience. But you can actually make sense of voices, and it's not for everybody. I mean, some people do choose to just live and ignore or contend with or put up with their voices. A few weeks ago... And
I suppose it's like that with everything. Some people just put up with pains as well that they
absolutely
probably wouldn't need to.
Well, I spoke with a gentleman a few months ago who started hearing critical voices, and again, he kept a diary. We did a voice profile. He wrote out a little bit about when the voices start, when they stop, the nature of the comments, etc., etc. And when we met for coffee, I said, where do these voices come from? And why have you just started hearing them now? Well, here's the deal. He's been given extra responsibilities in his role in the law firm. He's not entirely convinced he's able or equipped enough to do that. He started feeling stressed about that, which was gradual but got bigger and bigger over time. But the other interesting thing, he told me that these critical voices came from his university studies of some 10 or more years ago, where he was bullied by a small cadre of men at the university, older students, who decided that they would choose him, to be the person that they would make the butt of all their jokes. They made him ill with drink, and he didn't really drink, and they had T-shirts made with him being sick on the toilet floor. And the irony of it all, I said, well, why has this come back to sort of visit with you again as an experience? And you know what it was? There's a new employee who's a senior figure at the legal company where he works, and this gentleman resembles physically, physiologically, one of the people who made his life miserable all those years ago at the university.
And see, that could be such a healing thing. If you could connect the dots, you'd probably resolve issues. These experiences could lead you to resolving issues that might be huge traumas if you could take the positive side of it.
For sure. When I used to talk with health professionals about those perceived benefits, the ones that you've just mentioned, one of the responses, sadly, not that they were happy to say it, was the identity, because people used to talk about lifting the lid on Pandora's box. They used to say, some of the nursing staff or other health professionals, and it's not that they didn't want to help, but they'd say that was the received wisdom. They were like, well, if you start talking to people about the content of their voices, the subjective experience that they're living through, the feelings that those experiences engender, and the legacy of that, you're just going to end up working through a whole heap of stuff which requires lots of different healing, which isn't available either because it isn't resourced, or there's no recognition within institutional psychiatric settings that would be a useful or beneficial therapy to offer to people. So I saw all the doors, all the pathways to recovery for people diagnosed with schizophrenia are pretty much closed. You've got to do it for yourself with support from allies and other professionals, and family members and people who care about you. You sometimes only need one person to be an inspiration and someone to talk with and listen to and help you in your journey of recovery. But recovery can be completed. The book on the right of these three is Living with Voices. This is 50 individual stories, so it's quite a compendium of, and it's heartbreaking and inspiring and a little bit scary and also energizing, because you go on the ride of the experience. It's told by the people who've lived through the experiences. And these are books that came a long time after Maris's research. I mean, when he'd been on the Sonia TV show, he did a little more research, because he went back, he's already treating a lot of people in hospitals. I don't know if you can see this Roman Escher 1997 slider I'm showing you here. They were interested to look at all the folk they were treating as patients at the time, and to see if there was voice hearing was taking place within the different groups of people in those different categories. So I hope that's clear to see that voice hearing. People were asked, and again, the questionnaire that was used initially for the folk who responded to the Sonia television show was very interesting, because it showed that a group of people who heard the critical voices actually could cope with their experiences. And one of the things that was done was a Resonance was the name of a movement that began in Holland, and they held a conference that invited people who had challenging voices and struggled to cope to meet individuals who had the same sort of experiences but were coping well. And then I think on the second day, if I'm correct, health workers, educators, mental health professionals got to meet people who had positive experiences of so-called auditory hallucinations. So that started a sort of a bridge-building exercise where some of the coping strategies, some of the experiences were shared, and that, I guess, that was the early seeds of an inspiring movement that has continued to grow into this day. So the Maastricht questionnaire is the name of the questionnaire that's used these days by many folk. It's a later development of the questionnaire that was used in response to the Sonia television show, but it's much more, sort of authoritative and deliberative, and has many brilliant questions that people are invited to ask. Now, one of the questions that Sondra, Escher and Marius were asking here about patients was who hears voices. So we can look at this chart and we see, the people diagnosed with having a personality disorder. Okay, 0%. The psychotic disorders, so-called psychotic disorders, 41% of the people with that diagnosis reported so-called voice hearing or auditory hallucinations. People diagnosed with depression and none of the other diagnostic disorders, I think it's 25% of those folk reported hearing voices, and interestingly, dissociative disorder, a very high percentage of people with that diagnosis reported having auditory hallucinations or voices that made life, clearly a difficult experience for them at times. And people with the diagnosis of schizophrenia, well, 53% of those folk with that diagnosis reported hearing voices. Now, it's interesting because the concept of both hearing voices in the sort of normal, in brackets, well population, and in some is an interesting one to contrast, because you start to see that people, for example, disassociation is an experience that people utilize quite often to survive impossible scenarios. People who are forced, subject to extreme physical and psychological, sociological pressures and treatments, like in war zones, or people who have been subject to serious sexual assaults or physical abuse on an ongoing basis, quite often have to sort of step outside their body in order to survive the experience. And I had a friend who worked in prisons in London called Mike Smith, with women who were, he was running a course on self-harm and exploring, was self-harm a strategy for survival and what other things it might do. And a large number of the group of women in the prison in Holloway reported back to Mike that they also had auditory hallucinations, or they heard voices, so probably a better way to put it. And Mike went back and did further work with them about the nature of their voice hearing, and in a very high percentage of those women, they were hearing voices that were definitely related to the experiences that they'd suffered when they had to use disassociation to sort of survive an impossible scenario. So, of course, and that was back in the 1980s. I think Mike, in that year, won an award for being voted by peers and clients as the Psychiatric Nurse of the Year, because he published some nice research and findings about that work, and he helped, in the foundations of the Hearing Voices Network. So you can see hearing voices right through a group of people with different, they're patients of Marius and Sondra, and this is their response to the questions they were asked. I've been looking at some interesting research today and in the last few weeks, and it's the prevalence of voices in nurses who work in mental health. 79 nurses and students working in the field were asked to complete a questionnaire asking about the prevalence of experiences they might have that could be considered auditory hallucinations. And although we don't have a slide to go with this, 84% of the 55 nurses who returned the questionnaires described having these experiences that they said were the equivalent of auditory hallucinations. And it's broadly consistent with other studies that find hearing voices is prevalent amongst non-patient groups of people. You don't have to be a psychiatric patient to hear voices, but sometimes hearing voices can accompany, be a side effect or a part of a journey for a person that can be very, very difficult for them. So they asked, back in this research just briefly, they asked about the attribution of voices, because Marius was very interested to wonder if a person's hearing voices, would that person say that the things the voices speak about or comment on, because people do have sometimes a single voice, it can be male or female, it can change its gender, which can be a little confusing, it says the same things. People can have a multiplicity of voices. 2 or 3 different voices and sometimes more. People can have a voice that started off as a single voice, other voices added into the mix over the years, and then all the voices blurred together, so it sounded like a sort of robot speaking to them. This is how it was described to be by one gentleman I worked with some years back. And one of our tasks there was to try to de-scramble that experience for him. And we can see here the people with a diagnosis of dissociative disorder, well, 100% of those people were able to directly relate their content of their voices and the subject matter that the voices spoke about to life events that they'd experienced. 70% of the folk with a label or diagnosis of schizophrenia reported that their voices were definitely linked, in their opinion at least, to life events they'd experienced, and 53% of people who were non-patient, so this would be possibly people receiving some support but not in a hospital setting, also reported that their voices were linked to life events. So this was interesting because it made Marius ponder questions about is whether a person becomes a patient or not, or becomes unwell or stays well, could that be somehow related to their own relationship with the voices that they hear and how they perceive and understand those voices, if that makes sense.
We've been talking for more than an hour. Why don't you talk about some of the very famous people who were voice hearers over history, because I think it's interesting to see how the perceptions have changed and how different people use these voices and how sometimes it's acceptable and sometimes it isn't.
Okay, I'm happy to do that. Can you see Sir Anthony Hopkins?
Yes, we can.
Fantastic actor. He's won many prizes for his acting. Okay, so just so you know, and it's in the public domain too, that, Anthony Hopkins came from a tough, hard-drinking, Scrabble town in Wales, and he went on to become, as we know, a renowned, world-famous actor with a lot of prestige and respect. And he sometimes has commented on the fact that he doesn't like arty-farty actors talking about the thespian aspects of being an actor. He sees it as very straightforward. He reads and reads and reads the scripts, and then he reads them all again when he prepares for a role. And sometimes to the point where he might be multiple script reading. He's finishing off a film project while looking at scripts for new projects he's been invited to take part in, and quite often he rehearses voices or characterization of voices in order to sort of fit his personality, amend it, modify it, and make it amenable to the role that he's been invited to play in a movie. Now, one of Anthony's secret vices was, I believe he held parties for celebrities and famous people as well as just friends and family, and he disguised the fact that he was a secret drinker when nobody else was around. So he was imbibing privately and drinking quite a lot, apparently, because he came from a little bit of a poverty-stricken background, and of course he's become a very wealthy person. He doesn't like he struggled a bit with becoming Sir Anthony Hopkins, what that might mean in terms of concept of self, how people perceive him. He says he's not always comfortable when people approach him in restaurants and bars. He comes across as a little bit grumpy. He's just out there having a meal, and he's just Anthony Hopkins, Tony. He's not Sir Anthony Hopkins. Now, the thing about Anthony Hopkins is his voices. One day when he was opening a bottle of drink, a voice spoke to him and said, "If you drink that, you'll be dead." And he sort of was a bit confused. One of the things Marius worked out is there seems to be three stages to voice hearing. The first one is the surprising onset, very discombobulating and throws people a little, and that's at the beginning of hearing voices, so people are a bit taken by surprise. No surprise, they become withdrawn and a little bit isolated, retreat into self while they try and figure out what the heck's going on. Are they going crazy? Second one is the voices sort of organise themselves into a structure or a pattern or a sequence. So some people have voices at certain times of day and night, or they appear in certain scenarios. I know a gentleman who only hears them every Wednesday. They're at their worst, and I asked him here in Edinburgh what happens on Wednesday that causes you stress, and he has to go shopping to a giant superstore with a support worker. So now that's done in the afternoon when it's very busy, so now they just shifted that to a nighttime visit, and his voices have reduced themselves to their normal level of activity. Well, Anthony Hopkins poured, after the voice spoke to him 2 or 3 times, he poured that bottle away, and then he went all the way around his house, finding lots of hidden bottles, I lived next door to a gentleman who had a difficulty with alcohol for many years, and when he moved out of his flat, I think we found 35 bottles of sherry and drink hidden in various apertures, bathroom cupboards, under beds, behind sofas, and all the rest of it. Tony cleared out his house of drink, and he hasn't touched a drop since, and he says he's never felt better. So there's an example of what you might call an alertive voice, a warning voice, that gives guidance at a time when it chooses to. Of course, it's always up to us whether we pay attention to those voices or not, and in this case Anthony did. If we can move, if there's any Beach Boys fans listening, Brian Wilson is considered to be a musical genius, one of a family that worked very hard, were driven very hard by their father. In the late 50s and the 60s, they became the most successful pop band in American history at that time, with a string of surfing hits, on TV all the time, constantly on tour. And then the Beatles came along. And then within a few months or maybe a year, the American charts were filled with British bands, so what they call the British Invasion. And Brian was a celebrity, an overzealous engineer of his own music and producer who was fastidious in trying to always get the very best mix for the very best sound. And he listened to Sgt. Pepper by the Beatles and Rubber Soul and was astounded at the lucidity and clarity and quality of the music that the Beatles were providing at the time. And this inspired Brian to even greater efforts to make what he thought would be the best single of all time, which is, of course, most people consider Good Vibrations to be the example of how brilliant, how a pop song that seems quite simple can be a symphony, a pocket symphony in itself. But also Brian was using a lot of drugs at the time. There were a lot of drugs around in California, so Brian was smoking a lot of grass and weed and taking uppers and downers and amphetamine. It's quite well documented, his own so-called nervous breakdown, and his famous celebrity doctor who worked with him in recovery and rehabilitation for some years, and eventually they co-authored a book together. But Brian started hearing voices really critically quite a lot, and people found it very difficult to deal with him. His behaviour became very erratic. I think I read somewhere that when they were producing Good Vibrations, there something like 550 takes of the song, and he would be listening to them for days on end, trying to pick the perfect one, always spotting a glitch or something that wasn't quite right, and insisting everybody do it all again. So now Brian is considered to be, he's somewhat rehabilitated. He's been touring in recent years. He does have an ear infection, which makes hearing music. He got that when he was quite young, actually, and it limited his hearing in, I think, his left ear. So that's been an annoyance for him too. And of course, we had things going on in the 60s. There was a great deal of social turbulence. The pressure on the Beach Boys to keep producing surfing hits and fill the coffers of the record label and the family bank accounts was immense. But Brian wanted to experiment and reach out in different ways, and take music into new territories. And well, people consider that the Pet Sounds album that the Beach Boys produced is quite often quoted up there with some of the Beatles albums as one of the greatest LPs of all time. Brian still hears voices, and he talks a little bit in the public domain about those voices, and they quite often, I think he hears accusing voices and helpful ones. And of course, the creative process is filled through historical records of artists, muses, musicians, theatre writers, philosophers and playwrights who've had voices at some point appear in their experience and either guide them or prompt them or warn them or advise them about things that they can do. And sometimes those people listen to those voices, and in Brian's case, his high standards of trying to make pop perfection drove him slightly mad, but also left us a legacy of fantastic music. If we look at Gandhi, the father of Indian independence, just very briefly, Gandhi's experience was quite tough. He came to Britain, to London, in fact, to study to be a lawyer, and I read an account of him wearing a top hat and an ill-fitting Oxford or Cambridge type frock coat and suit, and of course he learned a lot about the British Empire while he was here, because he saw the suffragettes being arrested and force-fed in the hospitals and the prisons, and so sort of his, as well as his other experiences of issues relating to civil liberty, it sort of planted seeds in him around equanimity and equality. And as we know, he's considered, through his actions, his self-sacrifices, his ahimsa approach of peaceful resistance, which he's led India to liberation and to independence. And he is still considered by Indians to be the father and the spirit of, independence for that country. Now, the way Gandhi heard his voices was through meditation, solitary isolation and prayer, and he would commune with God and ask questions in his meditations and receive answers. And if I'm not mistaken, a lot of the things that he learned in terms of his strategies for getting the British out of India are, as far as he was concerned, divinely obtained. They were advice that he received in states of deep meditation. So making his own clothes, getting his own wheel, and all the rest of it, and trying to show Indians that they could be self-sufficient. They didn't need to eat roast beef and speak like British people and follow. And of course, as we know, eventually India achieved its independence. By then he'd been thrown in prison, he'd been an ambulance driver in the Boer War, so he saw a lot of pain and anguish up at close quarters. He led people on the salt marches, as we say, designed his own clothes, jailed, but he's a pioneer of civil liberties, and Martin Luther King often, I think, quoted Gandhi as well. And then we have a beautiful mystic. If we want to talk about muses and mystics, St. Hildegard of Bingen in Germany, a 15th century, what would we call her, a monk, a female monk. She was the 10th child from a big family. She was very frail and ill all the way from being born, and she started to receive visitations or visions from the age of 3. At the age of 8, she was given to a lady called Jutta to look after. She was in charge of a small Benedictine abbey, and Hildegard was enclosed as a child. She learned to read and sing. Jutta actually taught her to read and sing. She actually became the abbot herself of that same Benedictine monastery in 1136. As she got older, her visions increased in intensity. So she started to talk about them, write about them. She spent a lot of time crying and laughing, and people obviously, word went round that there was this crazy mystic lady who claimed to be in divine communion with God himself. This threw up problems for the church, of course, being a patriarchal system which wanted to retain its power. And one of the things they didn't really want happening was ordinary so-called people claiming to have some kind of direct communion with spiritual authority, because that authority should only reside in the realm of, either the papacy or whatever church was concerned with this at the time. If everybody suddenly started claiming that they had direct revelations and communications with God, well, it throws all sorts of questions about the validity and authority of the church. So, but she was given permission by the Pope I think it was Pope Volmar, who got to hear from a letter from a monk about this lady's visions, and he said, please write up, if you wish to, any of your experience. So she wrote up accounts of 26 specific visions that included subjects as diverse as the relationship of God with humans and mankind in particular, the act of creation, the actual role of the church, what is redemption, and a series of apocalyptic prophecies. She was a very talented musician too, so she composed and played a huge amount of sacred music. There was a papal commission. Pope Eugenius visited Trier in 1147 and spoke with people who'd spoken with Hildegard, as well as directly communicating with her himself, and he confirmed that her visions were genuine, revelatory transmissions from on high. So she was given permission to carry on, basically. In 1150, they built a monastery. She wrote hymns, morality plays. She wrote early books on herbal healing. There are existing more than 300 letters that she wrote to kings, popes, and bishops and their responses to her. And she left 70 very sacred and beautiful musical compositions, which are still played and listened to by many people today because they're just so beautiful and sacred in terms of sacred music. And her legacy of her visions and voices for us all is she also left 2 fantastic volumes of natural medicine, Liber Divinorum Operium, the Book of Divine Works, and she was canonized, believe it or not, only in 2012. So she had to wait a long time to be Saint Hildegard, but what a woman. What a lot of amazing achievements. She left herself open to receiving transmissions that were validated and accepted by the Church, and has left us this beautiful legacy. So now, if I'm just going to pop down, we should talk about St. Joan of Arc briefly. She started receiving images of angels visiting her. She grew up in a very pious and religious atmosphere in her small village in France. And so it's easy to forget, isn't it, that people used to pray sort of 4 or 5 times a day. And there was a period in history where if you didn't actually go to church, people might come round to visit to understand or explore why you weren't there. It was almost compulsory attendance. But this lady, a virgin maiden, somehow restores a king to a throne and fulfills a prophecy that frees a nation from domination by foreign powers, in this case, of course, the English. And she was a simple country girl. The 100 Years' War had been going for a long time, so siege warfare was the order of the day. France was split into various groups and areas. The Burgundians and the English tended to team up against the so-called ordinary French people. When she was 12, she received a vision, and it was St. Michael who came to see her. St. Margaret and St. Catherine were also visitors to her. So she prayed a lot and went into the church. She asked to see the Dauphin, the Prince of France, who she thought this medieval legacy that predated her appearance on the planet would restore a French king to the throne. A bit reluctantly, she was given a little bit of support, but they thought, this is just silly. This girl she's been looking after sheep and goats, and she's a girl, and what would she know about liberating a country, never mind raising a siege of a town and leading an army. But she predicted the siege of Orleans, that it would be raised and rescued, and that happened, of course, and that inspired a great deal of excitement amongst people. She became a saint eventually, and is an early feminist in effect, because she cut her hair. I think, if I remember rightly, the Dauphin said, "I will dress in ordinary clothes, and if she can identify me in a room full of people, I'll know that there's something special about this girl." So some court advisors brought Joan into the court, and she walked straight up in the crowd of hundreds of people, and I think bowed in front of the Dauphin and touched him, and he said, give her some soldiers, and see what she wants. And so, well, the English caught her eventually. She was captured by Burgundians and imprisoned for a while. There are many accounts of the trials of St. Joan. Some fantastic movies have been made about that too. She is, of course, on French stamps, postage stamps, and is a patron saint of the country. And she was burned in Rouen Market in 1431. In fact, they burned the ashes 3 times just to make sure there was nothing left that people could take away as sort of heirlooms or inspiring legacies. But she left a legacy herself, and that was self-belief, independence of spirit and thought and freedom, and she's inspired many people throughout the ages as a figure of liberation, and she was canonized in 1920. And also the papal court found her innocent of heresy in 1920, so she was found not guilty, basically, but it took a long time to get to that point. And then just Moses, of course. Now, how many Christians are there in the world? How many folk say they're not particularly religious, or perhaps not even Christian, as we live in more secular societies? But if you ask them about thou shalt not kill, thou shalt not steal, and all of the legacy that was given to us by the Ten Commandments, brought down from on high, of course, after Moses' one-to-one conversations with God, then we realise that the implications of sometimes people having voices and visions and then bringing that to the rest of us is that many of us might subscribe to ways of thinking and belief systems that have been initiated, nurtured, or gifted to us by some of these prophets, these sages or these seers who have brought back something from other dimensions and gifted that to us. So it's quite amazing, actually, when I learned a few weeks ago that even the cell phone that we use, a part of the system of technology that made cellular technology and intercontinental phone calls possible, was designed by a gentleman called Alec Harley Reeves in the 1930s and 40s, who invented a thing called pulse code modulation, which meant we could have consistent quality when we phone people in other countries. And he got that idea, to some degree, because he was visited regularly in dreams by the ghost of William Faraday, the famous scientist and engineer from 100 years before. So, as you can see, now Philip K. Dick, people know Blade Runner, they probably know the film Total Recall. This gentleman struggled through his life as a creative science fiction writer. His films and his themes touch upon issues of identity, concepts of what is real and what isn't real, consciousness shifting. A lot of people consider him to be the most exciting science fiction writer. He wrote Pulp Fiction for short cash prizes just to keep himself alive for many years, and lived in abject poverty for some time until the 1970s. He developed a compact wisdom tooth which caused him enormous problems. He was living in a house where, in the same block of apartments, some members of the Black Panthers were abiding, and there were strange clicking noises on his telephone at times, and once there was a break-in that he claims was possibly things were ransacked, and he felt he was the subject of surveillance. And of course, many of the themes of Philip K. Dick's movies and novels and films touch upon aspects of, state power, state surveillance, and are we being watched and listened to all the time, and all the rest of it. When his medication arrived for his impacted wisdom tooth, a beautiful Christian girl on a sunny afternoon rang his bell, and she was wearing a fish symbol, the symbol of early Christians, and the sunshine glinted on her fish symbol, and instantly Philip was carried back to a historical period in his mind where he became a first century Christian on the run from the Romans as a heretic, and he started to write like automatic transmissions. He wrote an amazing book called Valis, V-A-L-I-S, which stands for Vast Active Living Intelligence System, and he had spells in psychiatric hospitals. He had a small circle of friends. He was married 3 or 4 times. One of the interesting things about Philip K. Dick also is it's a little less well known that he had a twin sister called Jane who died at 6 weeks old. And one of the abiding memories and issues that Philip was left with as the survivor of that those twin children, was had he taken some of the essential life energies from his sister, which meant that he survived and that she didn't, and he carried that residual guilt with him to his grave. But it also inspired conceptual juggles and challenges in his own mind and in his own writing, which explored concepts of personality, alternate realities, and all the rest of it. And so you only have to watch some of his movies and films to see. And now he's buried next to his sister, which is rather lovely. And just before he died, he was starting to get some recognition. I think Blade Runner was made, and he was invited on the set by Ridley Scott and guided round it. And he started to receive a little bit of extra revenues that made his life a little bit more comfortable. And then he went to Europe, where he attended a series of science fiction conferences where basically he was treated as a visiting star, and he really enjoyed himself. Well, I won't say it all came a little too late, because the legacy he's left us are his amazing stories in his films. And then we've got Socrates, the famous father of Greek philosophy. Well, Socrates had a voice which was an alertive voice, which simply means a voice that instructs you to not do things or not go to places, which he always obeyed, and called it his daemon. That's Daemon. There was a concept in Greek culture of indwelling spirits, inner guides that could prompt and speak with you, so it wasn't seen as particularly unusual, although quite often I read an account of Socrates, he'd be with a group of people on his way to a meeting, and suddenly, after asking him a question, they turn around to discover he's basically disappeared, and on calling round to visit with him later, they would say, where did you go? And he said, my demon told me, I needed to come back and work on some of my projects that I'm engaged in, because he was always engaged in amazing. Now, his legacy is amazing. You can go in any courtroom and listen to dialectical discussions between the prosecution and the defence, and they still do follow the Socratic method of inquiry, which is asking a series of questions, one after the other, that are designed to get us to an end point where we have some understanding of things. And of course, his famous trial and death with drinking a cup of hemlock is something that remains in the collective literary and philosophical memories. And then we have Robert Schumann, the German composer, considered by many folk who love classical music to be one of the best romantic composers of beautiful music of all time in the classical canon, mostly on the piano. I don't know if you know this, but Schumann wanted to be a world-famous pianist, but his father was determined that he should be a lawyer or a bookkeeper, and he sent Robert to university, where he hated every moment of his studies. So he avoided them simply by playing the piano for 15 hours a day at times. And his playing was prodigious, fantastic, but one of his concerns was that his hands were a little bit small, and he invented an incredible machine for stretching his fingers, which involved strings and wires, which were attached to the ceiling above the piano. And unfortunately, in trying to use this device, this self-invented device, to improve his reach on the piano, all he did was damage his hand, and it meant that he couldn't really expect to play at a high level. So he took to composing, and he began to write, and then he met his muse, a beautiful lady called Clara Weicker. She was 15 years old, herself a piano prodigy. They fell in love instantly. Her father forbade Robert Schumann to have anything to do with her. They wrote secretly to one another. The father discovered the letters and had them all destroyed, and took court actions to try to warn Schumann off having anything to do with his daughter. But their love wasn't to be denied, and when she was legally old enough to marry Robert Schumann, Clara and Robert got wed. And Robert moved from job to job and role to role, quite often with some insecurities about money, but also with a history in the family of mental health challenges that had taken some of his aunts, and I think a brother, if I'm not mistaken, at an early age, who died by his own hand. So he was a sensitive soul whose music, well, in fact, the year after he and Clara got married, I think he produced 180 complete compositions, and some of those, because he was inspired. So a modern doctor might say he was a great case of what you might call bipolar disorder. He had two voices. They were called Florian and Eusebius. Florian appeared first, and this was a kind of creative guiding voice that assisted him in his work, helped him in his compositions, consoled him and confided in him and urged him on. And Eusebius was a slightly more aggressive voice, a more critical voice that appeared a little later on. And as Schumann got a little bit older, the voices started to affect his life a lot more, and he ended up throwing himself into the River Ruhr in an attempt to kill himself and take his own life. To make matters worse, he wasn't recognised by the people who dragged him out and rescued him, but his abiding memory was their laughter at the condition that he was in, and so he was admitted to an asylum where he stayed for 2 more years before passing on. Now his legacy of music, even by other composers, is considered to be a remarkable one. So, I think Clara kept alive the legacy of his work. And then I think finally William Blake, prototype neo-hippie, poet, engraver, visionary. As a young boy of 8 years old, he reported on coming home that he'd seen cherubs in the treetops on Peckham Rye Common in London, and that one day he screamed because he said a big bearded face was looking in the window of the house that he and his mum and dad lived in, and he said it was God. And I think his dad went to get a stick, and his mother said, no, let's just not hit him with a stick. This boy's interesting. They sent him, he was apprenticed to an engraver and sent to Westminster Abbey, where he was surrounded by esoteric, spiritual, mystical atmospheres. His job was to draw all the Gothic images and copy famous engravings. He studied all the classics, the Bible and Milton. He was very clever. He fell in love with Catherine Bucher, and together they spent an enormous amount of time reading and writing. He produced beautiful prints and images. People know him mostly for his poem Tiger Burning Bright, and Jerusalem, of course, and his beautiful books of poems, Songs of Innocence and Experience. He wrote essays on the French Revolution and called for the abolition of American slavery and Britain's role in slavery too. So he was a pamphleteer. He wanted America to be an independent country. He was considered a bit weird and eccentric, slightly different kind of person, a pipe-smoking guy who sat around naked as a naturist with his partner Catherine. And so people, their house became a habitual visit for, playwrights, poets and philosophers who came to London. So he inspired Gnosticism and was interested in alchemy and yoga and the Kabbalah, and is considered to be a bit of a proto-hippie by lots of people. He died laughing in his own bed, singing hymns to God, describing the visions of paradise he could see, and he's inspired whole art movements, movements relating to spiritual growth, natural and romantic. The sort of New Age movement took a lot of inspiration. William Morris, of course, and he engraved. He was a poet, a spiritualist, a visionary, and I think a bit of a hippie too. This is a beautiful image of, I think it's Horizon measuring the universe. So there you go. I'm sorry to go on for a little while, but a quick trawl through just a few of the dinner guests we could have invited this evening to our collective potpourri.
There are a couple of questions here. One is it important if the voice is someone familiar to you, or should it be alien to be true hearing voices?
That's a very good question. I don't think, personally, if you're hearing a voice, it's not unknown for people to be away from folk they know and hear their voices. So there is research that shows first-year university students away from home, settling into a new landscape, unsure of the pecking order that they're and how things are going to pan out for them. So there's a lot of little anxieties sometimes attached to going away to university. They quite often report in year one hearing the voices of loved ones, family members, back home. So, depending on the content of the comments that you're hearing from the voices, I don't think it really makes much difference. If people hear voices in their heads, we have our own inner monologue where we hear our own thoughts. I woke up a few mornings ago with David Bowie singing The Laughing Gnome at 6 in the morning in my head. I don't know where that came from. People hear voices from outside of their head. Occasionally, and in rare occasions, people hear voices emanating from various parts of their body. It's a little less common. So, no, I don't think it matters. If you're hearing a voice, you're hearing a voice. If it's not causing you any harm, distress, or anxiety, that's absolutely fine. If it's saying things that are beneficial to you, helpful to you, supportive of you, caring or nurturing about you, then I would say that you're very lucky, and I wouldn't worry about hearing those voices whatsoever. Do we have time to just point people to a few useful websites where they could get a lot more information and support?
Yeah.
Okay. If you're interested in hearing voices, if you work with people who hear voices, if you're a family member of somebody who hears a voice or voices, the following websites will provide plenty of good information, helpful strategies and links to things like forums. So you've got www.hearing-voices.org, so that's like the Hearing Voices Network's official website, and there's a ton of good stuff on there, amazing links, access to research, and a forum where people can link up and talk about their experiences. That includes a lot of professional folk as well as other folk. You've got www.hearingvoicesusa.org, which is the American Hearing Voices Network, and that is going great guns, and hearing voices groups are proliferating like crazy across the United States. My favourite hearing voices group at the moment is the Welsh one in Wales, United Kingdom. It's www.hearingvoicescimmeru, that's cymru.org.uk. And it's absolutely brilliant, really engaging. Again, lots of wonderful stuff. And they've also got packs that people can ask for free if people are interested in starting a hearing voices group, learning more about hearing voices. You get I think about $70 worth of amazing books, including some of Marius's books, and you get 3 DVDs on how to start and run a hearing voices support group. There's a DVD of Eleanor Longdon, amazing lady, who gave a recent TED talk called Learning from the Voices in My Head, that is winning all sorts of praise, where she talks about how she overcame so-called schizophrenic voices to cheat in her final exams and become a psychological therapist, and gives an inspiring account. And then Intervoice Online, that's the forum. So Intervoice, that's INTER. You have Working to Recovery, that's Ron Coleman and Karen Coleman. That's Ron, the guy I met all those years ago who was talking about his own life of hearing terrible voices. Now he and his partner Karen are a beautiful couple. They do a great deal of work in helping other folk towards recovery. And for young people who hear voices, or for people who work with young people, www.voicecollective.co.uk. And then for the Australians, you've got www.hvna, that's the Hearing Voices Network Australia, .net.au. They've got the annual Congress taking place in 4 weeks' time in Melbourne, in Australia. 650 delegates, 3 days of discussion, exploration and sharing around visions, voices, better ways of responding to a much misunderstood human experience. And then my own little website, which is www.visionsandvoices.weebly.com.
And his email address. You can also find him on Facebook. Ivan Barry is his profile, and then Visions and Voices is a page that he has.
It's quite a compendium of information with lots of books to read and places to go to get more stuff if people are interested in finding out.
So you have lots of resources. Also, if you need to get in touch with me, either my website, universaldancer.com, information about the programs is on my blog, blog.universaldancer.com, or you can email me at info@universaldancer.com. Obviously, the best link is the website, and then you can find all the different contacts from there. So I want to thank everyone for joining. I want to thank you, Ivan, for joining us tonight and speaking about this. I think this is an important subject, at least for people to become aware of, and you've given a lot of really good resources here that people can follow up on if they want more information. So thank you. Thank you for joining me.
Thank you.
Have a good evening, a good morning if you're on this side of the world, and hope to see you here again. Thank you.
Good night.